Okay, in Module 3, what we're going to do is look at cognitive behavior therapy and exposure therapies. So let's go get into that. What we see is that there are a variety of what we call cognitive behavioral treatments. And they use various research-based techniques to help troubled clients learn new ways of thinking, acting, and feeling. And the focus is on behavior change in the present rather than understanding the past or altering dynamics of personality. And that's really a direct response to the psychodynamic approach that we talked about in Module 2, because the focus is who cares what happened in the past? Let's go ahead and see how you can do now and going forward. So it really encourages this kind of collaborative therapist-client relationship with the direct efforts on the part of the therapist to change problems through the use of the various empirically supported treatments. And of most of the approaches that we're going to talk about, cognitive behavior therapy probably has the most robust evidence base when we talk about proven techniques, and they tend to be the ones that transfer pretty well. So one of the assignments we have in this class is chatbot assignment, and we're going to go ahead and use chatbots or artificial intelligence that are using the basis of cognitive behavioral techniques. So you'll get kind of a front and center view of being able to use these techniques without actually going into therapy yourselves. Now, what we're going to focus on in this particular module is much more the behavioral side of the cognitive behavioral therapy. So we got a couple modules on this, but the first one here is really focused on something called exposure therapies. And so let's look at the very first exposure therapy. Joseph Volpe, you can see him in the left-hand corner there, and he developed the systematic desensitization exposure therapy. And his assumption was that phobias were learned through classical conditioning. So if you remember the classical conditioning, we talked about Ivan Pavlov and some of his background. So this is the idea of linking a unconditioned stimulus to a conditioned stimulus to get the same response, basically. And Dr. Volpe felt that what happens is when a phobia is formed, we have an inadvertent classical conditioning kind of happening. And so what you have to do is you have to gradually eliminate the fear, and you do that through exposure. But before you do any of that, you're going to do it in a systematic way. There is something called exposure technique, just pure exposure, which is you basically do something what we call kind of an in vivo desensitization. You flood the person, but that's not what this approach does. First, it's going to teach you how to be relaxed, because one of the conclusions is you cannot be relaxed and tense at the same time. Your body can't be in those two states. They're diametrically opposed. So if we teach you how to relax through something called progressive muscle relaxation, in other words, where you're more aware of how you can get into a calm state, and you do that by tightening and then releasing various parts of your body. So you would like tense your shoulders, hold that for a bit, and then relax it. And that tends to have an overall relaxing sort of influence. What you're going to do then is have a hierarchy of fears. So let's say that young man there is afraid of spiders. So the first thing you do with systematic desensitization is you're not going to expose them to a live spider right away. So it's like, how would you do about with a picture of a spider versus the names or somebody saying spider, or having a spider that you see but is in the next room or divided by a window, and having a spider who's actually on you. And so you create a hierarchy of like, yeah, that would be really scary. No, that wouldn't be as scary. And then what you do after you're doing from the very mild kind of fears to the more intensive fear settings is you begin to expose yourself to each of those. So the mildest of, okay, if I see a picture of it, okay, that's the mildest. So we put a picture out there. Remember, we relaxed before. put a picture out there and say, okay, relax, just be with the spider, the picture of the spider there. Nothing can happen to you. Just relax. And after a while, that's not going to evoke any sort of response because the pairing has started to be severed between that unconditioned stimulus and conditioned stimulus. And when you have that kind of split there, what you're going to see is a lessening of the overall fear. Okay, so here we can see another illustration of systematic desensitization, once again, of a spider. And you begin to see the picture of a spider, the toy spider, a dead spider, a live spider. And you can see the same response, very high heart rate initially, and then over time it decreases, it desensitizes. And so eventually you do the same thing to the actual live spider, and then voila, you are done with your phobia that has been extinguished. So very, very effective technique for these type of things. Now, there are some other exposure therapies out there. And so Barlow said, in order to conquer your fears, you just have to confront it. This is kind of in the old get back on the horse that threw you kind of idea. In other words, if something is fearful, if you expose yourself to that fear and nothing bad happens, gradually those fears are going to go away. So in vivo desensitization is going to be where you gradually confront your fears in real life while simultaneously maintaining a state of relaxation. So you would go out into the real world, whatever that fear might be. Maybe it would be ordering at a fast food restaurant's drive-through. And so what you would do is relax yourself and you would expose yourself to, say, a drive-through situation for just a little while, and then, and then you would gradually do it more. That's in vivo. And flooding is just confronting the fear at full intensity. So in vivo might even, if it's the drive-through thing, rather than have you go through the drive-through initially, maybe it would you practice it in addition to calming yourself. You practice. So maybe you use your therapist as the drive-up speaker, and you practice with your therapist first. That's how you gradually kind of confront fears in this in vivo kind of desensitization. Whereas flooding is pretty much putting the person into the situation, and you have to confront it in full intensity. So if you're afraid of spiders, guess what we're going to do? We're going to put you in a room with a live spider, and we're just going to wait until your fear response has dissipated, you realize nothing's happening, and you finally calm down. Obviously, this is going to be one of the more traumatic ways and approaches for the exposure therapy, and is not really used too often. Usually we go with the more gradual desensitization to make it, when you get full exposure, much more manageable. Now, there's one other exposure therapy, and that's aversion therapy. And what you want to do with aversion therapy is they're using classical conditioning, in this case, to create rather than to eliminate an unpleasant response. And so there's some controversy in regards to aversion therapy. You'll see why, because usually it's used to primarily treat substance use. And so there are medications that you can give, say, heroin addicts, that the heroin is not pleasant for them in experience, and in many cases it may make them sick. You also can see this like in people with cigarette issues. So they may smoke, and yet they've taken a pill that the nicotine actually makes them nauseous versus pleasurable. So why would you continue to do something that makes you nauseous? You're going to go ahead and quit. So you've basically you're kind of creating a phobia for an unhealthy habit. As you can see here, the effectiveness is really not clear, as the relapse rate tends to be high. So there is some short-term success, but it's not enough to extinguish whatever unpleasant habit or response that you're trying to deal with. So kind of concluding about the various exposure therapies and aversion therapy, systematic desensitization, very successful for treating phobias, as is exposure, just general exposure therapy like in vivo. Flooding, probably not used too frequently, and aversion therapy, kind of mixed results in regards to that. So that's going to conclude our behavioral focused cognitive behavioral therapies. And next, we're going to focus on a little bit more behavior in regards to contingency management and social skills training. So stay tuned for that one.